All right.
Right. Well, welcome everyone. This is excitingly enough, this is Black Maternal Health Week. This is the first day of Black Maternal Health Week, the 5th annual Black Maternal Health Week, and we are excited to be here. And my name is Adjoa Jones. I am a public health leader and a Black maternal and infant health advocate, or I could just say maternal and infant health advocate. And I'm excited to be your co-host for I'm Just Saying, Two Black Women with Opinions. And tonight we're going to be having conversations with some of our student physicians that I'm grateful to have here, and we'll allow them time to introduce themselves. But before they start, I want to pass the mic to my infamous co-host who's just back from
Zanzibar. Woo-hoo! Tanzania, East Africa. And if I act like I have been on vacation, know that I have. My name is Jan Robinson Flint, and I am the Executive Director of Black Women for Wellness, and I'm also an interim Executive Director of Black Women for Wellness Action Project, which is an advocacy organization. So I'm wearing 2 hats right now, which is okay, because I have all this vacation energy to move off of it from. Black Women for Wellness has been around for 23 years, and our mission is to lift the voices and experiences of Black women and girls with the intent of eliminating, and we chose that word deliberately with intent, eliminating health disparities. So it is absolutely my pleasure to speak with Precious Moment and Bethlehem Michael as med school students, because we know it is absolutely imperative and important that our next generations of healthcare providers look like us, share some of our lived experience, and have relationship with our community before they are all white coated up and the things that come along with that. So welcome, women, and thank you for joining us this first day of the 5th year of Black Mamas Week. So the Black Mamas Alliance and Black Mamas Matter Alliance, I'm like, there's another M in there. Black Mamas Matter Alliance started this movement to bring attention to a challenge that we've had at least for 400 years in this country, and that is maternal and infant death among Black folks. And for the last 5 years, during this Public Health Month of April, they have been really shining a light on what are the challenges to Black women when it comes to being pregnant and giving birth. So we are looking at this challenge from a number of different ways. We're looking at it from a structural or institutional, and we're looking at how racism, implicit bias, sexism, and misogyny also influence our birth outcomes, right? So I'm gonna pause now and give you two a chance to introduce yourselves and to talk about how you came to be here with us tonight. Before we launch into our subject matter on, I'm Just Saying, Two Black Women with Opinions. So Precious, why don't we let you go first, and then we'll come to you, Bethlehem.
Hi, thank you so much, Jan, for having us here, you and Adjoa both. So my name is Precious. I am in my 3rd year now of medical school. I'm in both in the UCLA David Geffen School of Medicine and the Charles Drew University combined medical education program. So I'm a student at both medical schools. And I'm also in the Prime program, and it's a joint degree program. So I'll be getting my master's degree after my 3rd year in medical school. With the mission of the Prime program is to create physicians who are going to be leaders and advocates in eliminating health disparities in underserved communities. So that's where I'm at right now. And before I came into medical school, I used to work in the healthcare field. I used to work in the OR as a surgical nursing assistant for a little over a year. And then I worked at Children's Hospital Los Angeles as a care coordination assistant. So I had some work experience in the healthcare field and did a lot of volunteer work in Mexico, leading like free clinics monthly in Mexico before I decided to go into work and then came into med school. And I'm from here in Los Angeles. I was born in Riverside. Me and Beth are both connected by Riverside. And then my family moved out here to LA. So I consider LA my home, but I have roots in Moreno Valley, Riverside here, San Jose. So yeah, a little bit about me, and my interests overall are to go into an OB-GYN residency and to do a family planning fellowship after that. And yeah, and hopefully I haven't decided which master's degree program I'm interested in. I'm more so interested in business. I'm interested in learning about insurance and making it more equitable for us to access healthcare and more affordable. So there's a lot of interest I have there that I'm still exploring within these next couple of months before I'll be applying to my master's program. And I will pass it on to Beth.
Hello, and thank you all for having us here today. So my name is Bethlehem Michael. I go by Beth, and I'm also a third-year medical student here at UCLA. I'm in the same program as Precious. It's Prime LA, so the program in medical education for leadership and advocacy. And so very same thing that Precious said, we're training with the hopes of addressing and eliminating health disparities within our local communities. And so I'll also be going on to get a master's degree after this year. As of right now, I'm thinking like community health sciences. I want to do some kind of like community-based participatory research program, something along the lines of that. And yeah, and in terms of like what specialty I want to go into, for a long time, I was set on wanting to go into OB-GYN. But I think, I don't know, something about my experiences in med school kind of made me want to take a pause and just broaden my perspective a little bit. And now I'm leaning more towards like pediatrics, specifically like neonatal medicine, because I think, I don't know, there's a lot of work to be done there too. And I feel like pediatrics is such a huge field that you can do so much advocacy and like addressing and eliminating health disparities as well. In terms of like my background and where I'm from, so like Precious said, I'm from Riverside County, so like the Inland Empire. My parents are immigrants from Eritrea, so it's a small country in East Africa. And I guess part of why I was interested in like OB-GYN in the first place was also just hearing my mother's stories and like how she had very difficult pregnancies and like being forced to kind of choose, like, is it you or the baby? And so I think kind of my desire to like eliminate health disparities in like OB-GYN kind of started there. But yeah, so that's like a little bit about my family, where we're from. I went to UCLA for undergrad. Similar to Precious, I did a lot of like community-based work. I was a part of Flying Sam's as well, so like working with free clinics. I was a part of American Medical Women's Association and did some research in OB-GYN. And then after that, I graduated, went on to work as a teaching assistant in a biochemistry lab at UCLA because I really like teaching. So yeah, that's where I'm at. And that's like a long-winded explanation of like who I am. But yeah, thank you for having us here today.
I think it's important for you all to share who you are, so it gives us your worldview perspective, right? And because that way it gives us context to the questions that we ask and the answers that you give us, because those things are important. Where you grow up in terms of Riverside or Los Angeles are important because it informs your worldview and it informs how responsive you'll be with your patients, right? Because remember, one of my things was, we need patients who have our shared lived experience, right? Our parents being immigrants, especially immigrants from, I don't know, it feels like every country is war torn, but every country that has had, the issues of civil war and, that type of thing also informs who we are, right? It informs our perspective. So thank you all for sharing that, because like I said, it gives us context to the questions that we ask and the answers that you provide, and knowing what type of healthcare we can look forward to that you all provide.
Thank you. Thank you. And thank you both again for joining, as Jan shared. We wanted to also ask, how did you hear about our work? And then what, brought your interest to some of the work we're doing in LA County? And then we'll dive into some of the questions. And as we shared previously, you can say as students, I'm going to forego that, or I will parlay that for after graduation.
I feel like me and Beth can jointly answer how we got to where we are and how we found out about AIM and you, Adjoa, because for me, so me and Beth, we used to be coordinators of on campus, like through the medical school, our chapter of the American Medical Women's Association. And what both Beth and I, during our time as the co-coordinators of this organization, we realized we were the first to, like, Black women to be the head of this organization that's centered on women's advocacy, like reproductive justice, and just all the health disparities that comes into being like women and uplifting women. So it just came to us like in our time serving these positions that we could do so much as Black women leading this organization and raising awareness to our colleagues who are going to be healthcare providers, physicians in all these different aspects, whether that be psychology, surgery, family medicine, who should also be aware of the health disparities that we face as Black women in our birthing outcomes and our children. So I think that's when me and Beth got to talking, and Beth had already had a connection to Adjoa. I believe she should speak on how she had that connection. And that's when we reached out and wanted to form a partnership between DGSOM and AIM and form more connections with the community, because that's what we came here for. And it just kind of felt incomplete that we were having our medical school education, but we weren't really with these aspirations to be physicians that are within the community, but being so detached from them throughout our education. So I'll let Beth speak a little bit more on how she helped get us to that point.
Yeah, so just very briefly, I was a part of like a women's health selective. So that's like an optional class that you can take alongside the rest of your courses in med school. And so each week we would meet and we'd have like a topic within women's health that we'd discuss or have like guest speakers come and talk to us about. And so that's when we had one day where Adjoa came and talked to us about AIM and like the work that they were doing within their community. And like Precious was saying, it was the first time that I really heard anyone within the UCLA community addressing anything about like, Black women's mortality rates and like infant mortality rates. It wasn't something that like, sure, people say it all the time, right, within like these academic institutions, but it doesn't really seem like anyone was doing like community-based work to address anything. And I don't want to say that because maybe there is someone and I just don't know them, but like I tried to find folks, I couldn't really find anyone and was, being given the runaround. And so yeah, that's how both me and Precious reached out and we kind of formed this partnership and, looking forward to seeing how it grows in the future. And I know there's a lot of other students like us that, maybe they're not here on the call with us right now, but have the same like passion for addressing and eliminating this disparity, but don't necessarily have like the means to like, mentorship or connect with the community through our institution. And so that's why we're here today. But yeah.
And thank you for that. I'm very grateful to you both. I'm very grateful for the opportunity to collaborate because we're very excited. Looking at Black Maternal Health Week, we are finding that when I hear discussions like this morning, there was a kickoff conversation, and actually it was the Global Midwifery panel, right? And that was very exciting because actually, Jan, I don't know if you got on today, but they were coming, and the sister was from Zanzibar, and they were talking about, you know, the work going on in Zanzibar and how they're going to take some folks back to Tanzania. And they're going to do a trip there and do some of the work with the nurse midwives there. But what was astonishing to me was what was mentioned was that there are 30 counties in Georgia that like lack an OB-GYN. And so nurse midwifery would be, you know, ideal in some of those places. So when we say rural, we don't want people to think Black folks don't live in rural areas, because there are rural counties throughout our nation where Black folks reside, which have left, you know, them without the proper care and services. So, you know, and the work that a midwife can do, and that midwives, you know, have been doing globally, not just here in the States, but globally, you know, since I want to say the dawning of time, since, you know, the beginning of the ages, that could, you know, really be happening now. So when you guys reached out, I was very excited. I shared with like a team, I'm always sharing, especially with nurses and physicians and future physicians reach out. And then we have some that come into the spaces and say, hey, I got to leave this space for a while because I'm going to medical school. And we're like really behind it. So we want to wrap our arms around you all as well, because you will be the next generation of medical leaders that are going to serve our community. So it was exciting for you to reach out and say, hey, what could we learn to change, you know, what is happening today, to be involved in the change of inequities and to ensure that there's equality in healthcare. And even from your class, there were other physicians there and your students that were interested in saying, you know, how do we better serve and learn as physicians? And so I think that's great for incoming medical students that will become doctors, that happens, and that we bridge the gap between community between community and provider, right? So I'll pause there. I'm going to help.
I'm going to jump in since you paused. Okay. And I kind of have two questions, right? And I think it is very interesting that you all were very proactive in seeking the education that you need and the education that you want to provide culturally relevant services that actually move toward eliminating health disparities in our community, right? So my question is, if you were to design a medical school program, how would you design it differently than it is now so it would better meet the needs of the people that we serve? So how would you design it differently than it is designed now? And then what would be the requirement around connection with community for future health providers? And so when I say health providers, I'm taking a broad stroke here, not just medical doctors, but also physician assistants, nurse practitioners, midwives, et cetera. What would be those requirements? So I'm going to ask the first question first is, how would you design a medical school program that you think would meet the needs of folks now?
So, thank you for this question. I feel like it's difficult because you know, I'm not even going to speak from my own experience that as a medical student here at UCLA and Charles Drew, because I'm very grateful to be here, and what I have learned and what they have given me in my education. But outside of this, I would say that, thank you for this question. Oops, is there feedback? I would say that, like one thing, like the big thing I was saying is that we become so, it's like they say it's like drinking out of a fire hose. When that's the amount of information that we are being given and crammed into 2 years, and that's just how it is across all like medical schools. And I think that I know that's just how it has to be for us to get to the point where we're in our third year and we're actually in the clinical setting. But I think that having more room to be in the community, and I don't think from like a clinical standpoint, because I don't think relationships and trust are just built from us having like wearing our white coats and treating you and caring for you. I think more so like being a community member and seeing like I don't know like events like these I've seen like it'd be done like having like church events or something like that, or just something where you can take the white coat off and you can see me as a person and we can all see that we are connected in these different ways. And I think that is helpful in terms of people who come from different backgrounds because of like for me, like when I used to go to travel to Mexico when I was in undergrad, I didn't spend most of my time looking at patients. I spent most of my time connecting with them, having conversations with them, getting to know them outside of being a patient. And I felt like that built trust that allowed me to see their life in a full view, not just from them coming in with like heart disease or diabetes, to see like what else contributes to them being this person that comes in with heart disease and diabetes and what their life circumstances are leading up to this point. So I think having more opportunities to interact with the people who will be our patients while we're learning and not being disconnected from the real world, because that's what we are, is kind of disconnected. I think like finding a way to do that, I don't know the most efficient way to do that. So that's why I'm saying this is a hard question to answer. And I think also we are taught that research is the way for us to distinguish ourselves amongst each other. But I personally feel like all the research is there. Like we know that this health disparity exists. Why do we continue to do research on that when we know it exists? So having like translational ways to turn that research into action and seeing how our mentors don't have to be physicians, like they can be people who have MBAs, they can be people who have MPHs, and being able to see what they do for a patient or what they do to address this particular disparity, I think can be extremely helpful for us and help us have some more perspective about what we're getting into and what we can do as physicians in the future. So yeah, like finding ways that we can connect with our patients as people is one, and then seeing how that interdisciplinary care team is working, even outside of the clinical setting, to address these issues that we say we want to address as physicians. So that's my thing. I'll let Beth say some things too.
Yeah, I think this is a very hard question to answer, mainly because, we're just kind of in med school, right? And it's a very isolating experience in the sense that like, we're so busy that we barely have time to like even go out and do a lot of like community work or, and this is coming from the perspective of us being in third year medical school. But I think a few things come to mind. So the question was like, how can we make a med school that meets the needs of folks like within the community, right? And so I think part of it is like just strengthening like the pipeline, right? So we need more physicians, we need more healthcare providers from the communities that, we say we want to serve, but it's like the folks who know how to serve the community best are the ones who are from the community, right? And so I think strengthening the pipelines from like kindergarten and beyond, so that way like getting into higher like medical education isn't as difficult as it is right now, where it's like there's this false scarcity that's created by whatever institutions or like maybe I shouldn't be calling out places, but like I feel like there's a false scarcity that's created that doesn't necessarily need to be there, because we're also talking about how there's like huge shortages of physicians, or like people can train for 4 years in medical school and not even get into residency. And it's like, that's not working. And so I think part of that is that, creating a medical education system that is, has medical students from diverse backgrounds, from the communities that we're serving, and also like sustaining and retaining them throughout the entire process. So that's like one thing, right? And then the other thing that I like about being a prime student is that we have like we all come into med school with the same like ideas, right? We want to work within our local communities. We want to address and eliminate these disparities, right? But I also like how for us, we had a summer project that we did as a group together before we even started our first year of medical school. And this was like a project that was like community based, and like we had a hard time getting it like done because it was in the midst of COVID. But it was like we came in with the idea of like, okay, we want to create some kind of community based project that can make some kind of impact within our local community, right? And even though that's like a very small idea, I feel like if med schools just took the time to like be like, okay, why don't you try to pursue activities like this, right? That could also make a pretty big difference in local communities, right? And I know like one prime project that was done a long time ago, it was called like the Happy Feet Clinic, right? And this was an idea that stemmed from students where they like would go and serve unhoused folks and like give them a clean pair of shoes and like wash their feet. And that made like a huge difference. And that clinic is still going to this day. And that was established like, I want to say over 10 years ago. I don't know. But yeah, I feel like just having more of that kind of mindset going into medicine or a part of medical education also makes a big difference. But yeah, those are like my thoughts on how you can make a med school that serves the community. But yeah.
Thank you both. I think that those were very excellent answers, and we understand, as you're learning and growing, it can be varied, right? Like on how you feel and what you should share and what you want to do. And we are looking forward to you joining this field. And especially I'm excited, Beth, as I heard you share earlier, and I like to I always call them Dr. Beth and Dr. Precious, because we're speaking that future, into existence. We know it's going to happen. We're getting behind you and getting our community to get behind and push you forward, right? I think what was exciting for me is as you shared about your mother's experience, right? And how that, propelled you. But maybe if you want to go more in depth in that at all, or from any of your experience thus far, I think it was like what really grabbed me was when you said the decision between mother or child, like who's going to survive?
Yeah, so this is something that my mom always shares with me, and like, thank God she's alive, she's healthy, she's okay now. But I know that she had 4 kids, so there's 4 of us. And when she had my oldest brother, like she was a pretty recent immigrant to this country, like probably only 2 or 3 years. She came from like Eritrea, and this was in the midst of like our fight for like independence and everything. And so she came here, she met my dad, they got married, and didn't have any like support, didn't really know much of like, the hospital system or anything like that. And I remember she told me, she was like, I was all alone. It was just me. And I gave birth, like she got a C-section because they told her like, oh, you have to do a C-section. And I don't know that like much of that was communicated or like why she was kind of like, pushed into that decision. But she's like, okay, I just got a C-section. And then after that, like she went home. And again, like there was also the, I think just her being on her own and not having any like social support kind of took a toll on her. And so after that, she ended up having me a couple years later. And she said that pregnancy was very hard for her. And I think she had preeclampsia, and she was like gaining a lot of weight really quickly, and never had any high blood pressure, nothing like that prior to being pregnant with me. But all of a sudden, like she went to the doctor and she said, I don't know, something feels wrong. And when she went to the doctor, she was probably like 38 weeks, something along the lines of that. And like they said, okay, well, yeah, you need to do like an emergency C-section. And she said the choice that was given to her was like, just be prepared to choose, like, in case something happens, it could be you or your baby. And I don't know the details of why they told her to make that choice, but this is just something that she shared with me, right? And she was like, her and my dad are like people of faith. So they said, all we can do is turn it up to God, right? So we just prayed and prayed. And for her, she was like, it was a very easy decision. I was always going to choose my kids. But it's like, when I hear that, I'm like, what kind of, like,
Yeah,
what kind of,
who
yeah.
tells, right? Who comes out telling someone that and not really delving into like medically, this is what's happening, or having, I think that is the biggest challenge, right? As African Americans, that we're hearing more and more as women have shown up. Why did we get to this point this late in the game and then for generally by then 38 weeks, you're going to the doctor weekly. I think back then you were just about going weekly, if not every 2 weeks. I wasn't, it found out sooner. And then, given some options and opportunities, I recently heard a physician talk about, weight. Well, my thing is this: obesity in this nation is like a huge issue. So how much more could we be looking at nutrition as a nation, and even within our healthcare providers and communities, so that it's not really a lot of shaming, and really look into, because sometimes it's not the actual physiological, but it's the psychological that has led folks to obesity. It is what is happening in their, it could be in their home, it could be in their, we have food deserts, just not having what's passed down generationally, how we eat, and knowing the content of what is all in the food, as, Jan and myself, as we age, I know we're looking good, thankfully, but as we age, we have to consider the things that we're eating, right? You might, like I've really looked at vegetarian, vegan options, but when you go to some of the events, by the time they fried all the vegan stuff, they've added all the sauces and all the breads and whatnot. It's like, listen, go right on back to meat, because you've just killed the dream with adding all of those things, and the salt content and whatnot that is not helpful for us, or the sugar content that's not helpful for us, and how all of those things are very addictive. And
so let me interject right there, because I think one of the reasons why I asked the question about what type of medical system would you design, because you're in the middle of it right now, right? And by saying things like, it's like trying to drink from a fire hydrant, it's like saying, well, what we need to do is kind of like slow this down and figure out how to control, the amount of information you get, so you can absorb it and be able to use that information in terms of how you interact with people. And then the other thing with that, what we were just talking about, is that doctors are not required to take extensive or even 2 nutrition classes, right? I think it's 1 nutrition class. But so much of who we are in terms of our health status is dependent upon the food we consume. So that doesn't make sense in terms of the life of a medical school student, is that, you get 1 class in nutrition, maybe 2, and yet you're sent out to treat people, and then you're not fully equipped, right? To be able to say, well, wait a minute, what, you're a vegetarian? Well, how much fat, salt, and sugar are you taking in as you make that transition to being a vegetarian? But to even go back to Beth's, or Dr. Beth's statement, because we're going to speak this into existence, right? That, if someone says to a pregnant person, is, you're going to have to make a decision. It's a life or death decision. It's going to be you and baby, right? And they just give you that, and you don't have a support system, or they are unconcerned about your mental health, your stress level, right? Especially if we're dealing with someone preeclampsia or high blood pressure. Talk about, oh, let's just stress you out and put gasoline on this fire. That's what happens. But as we think about, or as I think about medical school, how do they, I don't know if you can teach this, empathy, right? Or how do they teach you to make an assessment of a client's mental state, stress level, support system, diet, so you can give them the best health care that is needed for the moment. So that's what I'm thinking about, just in terms of how do we design medical school that really meets the needs of community, as opposed to meets the needs of the medical system, to create scarcity so they can, be, charge high prices, right? But then even then, general practitioners don't make as much as quote the specialists, right? And so it encourages people to go into that whole specialist system. Not to mention that many doctors, when you graduate, you have hundreds of thousands of dollars of student debt. That's crazy, right? And that's part of this, something we need to change in that regard. So I think you all did excellent at answering that question and really highlighting some of the challenges and the highlights of going through medical school as you see it now.
I got to come off mute. Yeah, I totally agree. I'm trying to go back and you guys can, this can be a talk back, though it's, I'm just saying podcast, two Black women with opinions. Some of our opinions are facts and some of them, folks may decide that's fictional, not true. But nevertheless,
they are our opinions.
And we really work through these. If folks know us, they know we've been, at this a long time together, in agreement, in disagreement, but all in love. So, okay, what is going to, now, Beth, Dr. Beth, are you as well going to get your master's? Are you doing a dual? You're doing a dual too. I think you did say that. You're both, right? Okay. So, and I like, Dr. Precious, as you talked about that, like, doesn't always have to be public health, right? It could be something else. Like when you talk about policy, I think this is you're in the great space, like with Jan, for the Black Women for Wellness Action Project. We definitely can share with you all some great policies that are out there that are coming up that they have worked on. And, even from the California Omnibus Act to where it started with the Federal Omnibus Act, a couple of those bills and policies were co-written, developed by Black Women for Wellness, along with like Western Law and Poverty and National Health Law Program. March of Dimes was involved. Some of us from AIM were involved, but the leadership would definitely, with BWW, with the advocacy they've done throughout the years for Black women and girls. But which I think what's key here is, and I'm not sure, you guys can tap in and say yay, nay, what you think on this. One of the things we talk about, and I don't know if you catch this flack and you can let us know, in community, when we're dealing with this work and we've done Black Infant Health, Jan and I met, I don't want to date us, but we met, we'll just say, a few years ago, though it was decades ago. We met in the Black Infant Health space, right? We were working together. She worked for one organization and I worked for another. And it's been challenging for years to say Black infant health or African American infant and maternal mortality. Not challenging for us to say it, but for others to receive it. How does that work, or how is that working for you all when we're dealing with issues around a specific group or racism and bias in care? And is there anything that's being done from your perspective, school-wise, or even through the systems of care that you've been working? I don't know if you can speak to that. It's something to think about.
Yeah, I was gonna say, could you repeat the question?
So when it comes to policy and then racism and implicit bias, and then as it relates to focusing on one specific group, like, talking to folks, or even just saying, hey, I want to get in and work on this issue around AIM. How is there been any challenges with that? Or how do you see relating that to your colleagues in a way where it's about the humanity and it's not about the race or color of a person's skin?
Well, I'm going to speak a little bit about my experience, and then also what I feel like is a lot of students, doctors, and trainings experience. So for me, I knew I wanted to do OB-GYN, and I had originally thought I wanted to go into oncology, after doing my residency, doing a fellowship in like gynecologic oncology. And then I started to realize that like I always kind of knew about the Black maternal health crises. And I guess it was really became more alarming as I got more involved in gynecologic oncology research. And I just would ask myself, like, why am I still doing research on things that I feel like there's answers, like we have the research too, we have evidence, like how do we find answers to how these things exist? Why do we always trying to find the difference between how like people receive care at like low income like healthcare facilities versus like somewhere like at UCLA. I don't know if that would get me in trouble saying that, but so like we know that it's a difference. We know that there's a difference in care. Like why don't we just do something about it? And I think I realized the people around me don't really, or the mentors I was seeking out weren't really thinking in that direction of like, okay, how do we address the problem? More so like, how do we distinguish ourselves by highlighting that there's a problem and just doing work just to add it to like a CV or resume. And I knew that like this is like I said, as medical students, we're like taught just doing research. That's what we need to do to get to our next step, to get to be the most competitive people. But it's like, well, I didn't really feel right just doing work, and it really had no purpose. It really had no connection to what my values were. And I had to ask myself, well, what do I value? And I said, well, I value what the issues are of Black women. And so I had to take a step back and say, well, what are the issues in Black women within OB-GYN, within the field that I'm interested in going in, and like what's not being done. And I like that's how I came towards an interest in doing family planning and looking at the Black maternal health crises a little bit more, and looking at a policy standpoint with it too, not just what I can do as a physician. And I couldn't find a mentor, and that's what kind of disappointed me. And I think Beth was one of the first people I had that conversation with, and other Black women who are interested in OB-GYN as well at my school. And that's when she told me about you, Adjoa. And then I started to I even had this conversation with my partner, and I told him, I said, hey, I'm starting to think that my mentor doesn't have to be a physician, because what I've realized is they're not the ones doing the work that I really want to do, and how I want to build up myself to be a good provider one day. So, and I Adjoa, I literally, when I met you, I was like, okay, Adjoa can be my mentor. She can teach me how to be a good OB-GYN in the future, and what I need to do to meet the needs of my community. And I think
applaud you.
once I made that mental switch and decided to be make a change, hey, my mentor doesn't have to have an MD, they can have any other type of degree or credentials or any other experience, and I can learn something from them, and that's okay. I feel like that's what helped me. And then that's when we started, me and Beth started letting other classmates know. And that's how I feel like Emily, I'm not sure when we reached out to you, but all of a sudden I saw that Emily was connected to you. Right, and so I'm okay, Adjoa is just going to be building up the future generation of DGSOM, you see DGSOM, Black OB-GYNs and female healthcare providers and physicians. And so that's going to be your role from now on.
Well, listen, I'm extremely honored, because then I know that I'm going to get some good care.
Right. Yes.
If I have to switch my health plan, I know I'm going to care. So, but even more so, I know then that I will definitely connect you all, with the Association of Black Women Physicians and other organizations, because you do need, those who have gone through the spaces and definitely I don't mind, and I'm extremely honored, right? But I do want you to be able to tap in, and challenging enough, though we do want to have those that look like us. Sometimes we will open ourselves up, and they may not be the same skin tone as us or the race or culture, but they will be of the same mindset. So we do look for allies and partners who are like-minded, who are not looking at that. But it is great to have those of our own young or old. And I found younger mentors for me, and I found older mentors. And so definitely, Beth, I want to thank you for that question, Dr. Precious, and Dr. Beth. I don't know if you want to tap into that at all.
Honestly, I think, just reiterating everything Precious has said, I think, like, honestly, I'm in the process of also kind of re-envisioning what it is that like I want to do, because I found that being in medical school kind of makes it hard when you don't really know who to reach out to. Like I always feel like I've been like coming up against a wall, right? Where it's like, okay, here's an opportunity for me to explore this, right? And it's just not like, I don't know, it's not what I expected to be, or it's not like in the same way that like, this is the work I want to do. It's just, I don't know. It's just, I think it's part of it is just being in an academic institution. It's different. It's not like community-based work. And so I think that's why I felt like I kept coming up against a wall, and I kind of became a little like disillusioned, and I was like, I guess this is all there is to it. And yeah, like now I think, I'm really glad that we have this connection with you all, and like redefining the work that we can do as medical students and future practitioners is really nice. But yeah, that's all I can really say, because I'm in the process of like re-envisioning everything for myself.
And we appreciate that. I appreciate that transparency and honesty. I think that it would be lovely if we could connect you, especially like with physicians. I think a good one, Jan, is like Dr. Joy Queer-Perry. I remember doing an interview with her for our Birthing While Black documentary we're still working on, and powerful, just powerful. Time spent with her, powerful. I think like Dr. Jamila, she's on the East Coast, a reproductive justice advocate and physician. I mean, sat with her at an event. I think, where were we, Jan? Was that, it was either I was DC or New Orleans, one of the two, for a Planned Parenthood event. I think it was New Orleans, but I think, we have to ensure that we keep this going. And as we get ready to wrap up and close, one of the things, I don't know, Jan, do you have a closeout question? Because I was just going to see, some of those programs in my mind, like, I don't know what match is, and we'll come back. We'll have to, I think as we delve into the conversation, we start thinking about more that we could talk about and explore. You're on mute. You're on mute.
Let me take myself off of mute, because I can hear me, but you all can't. The first thing I was going to say, yeah, you're right about Dr. Adjoa, for instance, or even here, Dr. LaTanya Hines, who's a Black OBGYN colleague, Dr. Sherrod,
Dr. Tracy Sylvester. These are some amazing local.
So one of the things that we try to do is make sure that we know folks that, in terms of Black OBGYNs and other Black docs, Dr. Marcia Flint, et cetera. So we can point folks toward the resources that you all need to get through school or to get into practice, those type of things, because we know that there is that structural racism that is set up against you all, right? We know that y'all need money and other type of support to get through school. We know that, folks who have been down this path, that you don't have to reinvent it, that you don't have to be pioneers or trailblazers, because there are lots of folks who, who have been down this path and who are holding space for other folks to come down this path, who are, like you said, of the same mindset, same culture, same gender, et cetera. So it is hard to name racism. It is hard to name the implicit bias. It is hard to name the gender bias when you're caught up in it, right? When you're in the midst of it. And we get that. So, and that's why we absolutely appreciate you all being with us this evening during Black Mamas Health Week, and that we will be continuing these conversations. We will be talking about how do we work together as providers, as community advocates, as policy wonks, about moving that needle, about eliminating the health disparities. And the only way we do this is by attacking all the intersecting issues that impact us, from stress to food and nutrition to environmental toxin exposures. So that's what I'm looking forward to, that this is not a one-time conversation, but something that we do ongoing. So the folks who have went down the path before us can share knowledge, as well as we can share information and insights for the people who are coming after us.
Absolutely. Absolutely. I'm excited about that. We have plans for something in May with the physicians, and we could talk about that. Definitely a collaboration, Jan, with Black Women for Wellness. But we can talk about that. And it's really a town hall, possibly webinar. We'll see how things continue to go. Prayerfully, COVID just, yeah. So I just want to thank you all again. One of the things I definitely want to make sure in the future, you could think about that, and maybe you can close out with a quick tidbit. I want to really delve into how do we bridge the gap to allow for comfort between provider and patient, right? And are you all having the opportunity to learn that as incoming physicians, as medical students currently? And if not, is that something that you'll be able to bring up into the curriculum, or ask your instructors to something to explore, right? The relationship, how does that, where you build a level of comfort? Because really when people come to you, they're trusting you and they're trying to build this relationship and rapport. And we don't want to have the rapport, especially from providers. Well, the patients just don't listen. They're going to do what they want to do. But when, you have a better understanding and have communication, even if that means having your, a good physician assistant, or having a good nurse practitioner or nurse, someone who can communicate to the patient, if time does not permit with the physician.
I'm going to say this is so interesting, and I think it's so much to unpack that we need another program to do this, because we are running up against our 3-minute timeline right now.
Yeah.
Frontline staff is extremely important. And I think it's Precious, you said that you were thinking about business in terms of your dual degree, and that front office staff can make or break a whole relationship. But rather than go down that and unpack all that stuff in history and trust, blah, 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 let's give them an opportunity for a final thought for tonight. Yeah. And then we'll wrap this up, and you all can think about what we want to talk about next time. And who else you want to bring that we can ask these difficult questions of.
Well, and I also just wanted to briefly say that in regards to your question earlier about how we're bringing up these issues on race in this professional setting that we are learning in, the students are doing a lot of that work. Those students that, like me and Beth, are 2 students in our prime cohort, but there's a lot of other students interested in different type of fields in medicine, being leaders in different ways, and they've spearheaded a lot of the education about structural racism and how we can break down these barriers to addressing health disparities and talking about it amongst our colleagues that aren't Black, that are whatever the issue might be. So bringing that up into the space, so the students take a big role on spearheading those conversations and the initiatives. And I last thoughts. I guess I'm just excited to see where this partnership keeps going. I know that I relied heavily on Adjoa in what I've learned from in the emails to the email chains on what the different things that AIM is doing, as well as her plugging me in with them, the Black Women's Physicians Association, ABWP. But I have found some mentors who are OB-GYN, and I do recognize that they don't have to look like me to be helpful. And that's my next step, and hopeful to become the mentor that I'm seeking for somebody else, with my the MS1s, MS2s who are coming in who are also interested in doing this work. So thank you for having us here. And I'm looking forward to the town hall and what me, Beth, and Emily, who couldn't be here tonight, have planned on for that.
Thank you. Dr. Bethlehem.
Yes. So final thoughts from me. Yeah, overall, just want to plug what Precious said about our classmates. We have some amazing classmates doing a lot of work, like, anti-racist work, that, I honestly feel like they should also be a part of these conversations as well, because I feel like they have so much perspective that is like essential and necessary in having these conversations. And yeah, overall, I just want to say thank you for allowing me to be in this space as a third-year medical student. And, I hope that from future conversations with like people within the community as well, I hope that these are things that I can take with me as my, in my future practice, and hoping to become a physician that like listens and cares for my patients truly, because that's very, very important to me. So yeah, thank you for allowing us to be here.
Thank you. Thank you so much. We appreciate it. And definitely, follow up. I'll let Jan give the plug on her organization as we close out. But again, thank you for joining us for I'm Just Saying, Two Black Women with Opinions. I am your one co-host, Adjoa Jones, public health leader and Black infant and maternal health advocate. And I guess mentor to even some future physicians. Thank you.
Sounds like it to me. So the one thing I would say is that this is a podcast that will be posted on Spotify. You can look for IJS, Two Black Women with Opinions. You can also look for it on our website, bwwla.org. That is BlackWomenWellLosAngeles.org. And we'll post it up there before the end of the week. If there were questions on Facebook, because I was not monitoring it this time, we'll put some answers to those questions on that Facebook page. And the Facebook page is Black Women for Wellness, or Black Infant and Maternal Health. Is that the one, Adjoa?
It is now live on Black Infants and Families LA, the Black Infants and Families Facebook page. We did have content that said there would be a podcast every day. And I'm not sure if we gave the topic. So this still flows in line. We have an opportunity to switch it up. But we started off with you all. You have kicked off Black Maternal Health Week with a super bang.
Thank you so much.
Thank you. And we look forward to having you on again in the very, very near future.
All right. Ooh, look at those hearts. I see one. Yeah.
We have stopped the live stream. We'll stop the recording. Let me see.